Oh. And we are live. Good morning, everybody. Welcome to another wellness weekend. My name is Kathy Rañeses. I work as the in-house life coach. And with me today is Dr. Ryan Dalman. Hi, Dr. Ryan. How are you?
Good morning, everyone. Good morning, Kathy.
Good morning. How has your week been so far? It's been an interesting week for everybody, I feel.
Yes, I know. Actually, that's my description for this week. Very interesting, especially with COVID. A lot of things happening outside. No one knows what to do. No one knows what's going to happen. What's going on?
Yeah. And all we can do is kind of just manage our little
Same with the clinic.
bubbles for
We're
now.
forced to yeah, and we're forced to close this week because of the ECQ.
Yeah.
Yeah, all the
Well,
branches will be
yeah.
closed for our patients if they have an appointment this week, so we will be closed this week.
Mm-mm. But we
Sorry
still
for
do
that.
have telemedicine available, right? For those who
Yes, the
want
teleconsults will still be
have
available. Yeah.
consults. Yes. So there's still that.
Yes.
Yeah, it's kind of crazy. Like I know that you and Doc Candy love playing golf. That's all I've been seeing sa stories nyo. So it's like is this new ECQ going to affect your golf game or kailangan nyo lang talagang bilisan going from like one place to the other just to finish the golf game?
One of the things one of the things that we like about golf during the pandemic is that it's really a safe sport now because
Mm-mm.
there's no contact whatsoever.
Yeah.
It's out in the open. It's really windy. If you've tried playing golf, really really windy, and then we do stay apart.
Yeah.
And then yeah, it's a good exercise.
Hmm.
It's good for the skin too.
I
A lot of vitamin
know.
D3 out there from all the sun exposure to the sun.
Yeah, like you and Candy are rocking some pretty amazing tan. Sayang lang yung kamay, like hindi damay. So hanggang dito lang siya. And then you have me over here, like glow
I
in the
know.
dark na ako kasi halos di ako lumalabas ng bahay. It's crazy. So yeah, so like on the topic of golf and you and Doc Candy doing it a lot, I think it really kind of ties into our topic of our integrative approach to pain and recovery because I think it is a sport, nakakapagod siya. There's also a learning curve involved. Um, so yeah, in terms of the topic today and recovery, I think let's start with the most important thing, Muna. Like, what is pain, and how does that show up in our body?
Pain is really a subjective type of thing that patients experience. So I say subjective because one pain for one person is different from pain from another person. For one person with a high pain tolerance, maybe it's just a discomfort. But for the other
Mm-hmm.
person, maybe it's more problematic. That's why we usually ask the patients to grade the pain 0 to or 1 to 10, 10 being the most severe. So there are a lot of types of pain. So pain is a topic that can be discussed for weeks. All right.
Mm-hmm.
So I'll just make it simple. So maybe to simply state it, there basically I'm just gonna categorize it two basic types of pain: acute and
Sige.
chronic.
Mm-hmm.
Acute pain means you've experienced this pain just now and over the past three to 7 days, I think. So
Mm-hmm.
acute pain, it just happened. Okay, and chronic pain, you've been experiencing it for so long, months and years and years and years, like that.
Mm-hmm.
So acute pain, it can be due to again a lot of things. The most common cause of acute pain in our clinic is a traumatic type of pain, trauma. So
Okay.
when you say trauma, you hit yourself, you fell,
Mm-hmm.
you did an awkward action. Let's say you picked up something from the floor, or you did weights, or you overexerted yourself in sports.
Mm-hmm.
So that's when you experience acute pain. acute type of pain. Discuss the most common, I think. Okay, let's
Mm,
discuss the most common, okay? Because we're, as I
okay.
said, pain in general, it's very, okay? Kasi may iba pa dyan, infection and stuff like that, for trauma. That's
Okay.
the most common thing that we see in the clinic also. Chronic pain naman, it can also be caused by trauma, but the pain did not resolve. So it's still there. You
Okay.
got injured, and then, or the injury is severe that the pain has bothering you weeks after, months after, years after the source of the trauma. You struggle.
Got
I
it.
think my internet's struggling.
Yeah, a little bit. So,
Yeah.
sige,
Okay,
so
I'm back.
from what I understand, when you say acute pain, this is, for example, like I stubbed my toe. And medyo masakit siya. It kind of lasted a couple of days, pero nawala din naman siya on its own, more or less.
Yep.
And then chronic pain could be something like I had, I don't know, like a slip disc. And, it's been bothering me for years. I've been on pain meds for years. Um, and I can only, in my head, kaya ko lang siyang i-maintain, but the pain is going to be there forever. Tama ba? Oh no, did we lose Doc Rai? Doc Rai? Doc Rai? Okay, while I wait for his internet to reset, it's kind of interesting, though. Like at least for me, whenever we talking about pain and recovery, because it's actually a big part of our life, in terms of when we move our body. I know that when I haven't exercised for a while, and then I kind of go back to it, the next day I am just really really sore. But in my head, feeling that pain, I know it's because it's working. Like whatever exercise I did, going from like a 0 to a 3, um, is working for me. So I actually kind of look for that pain. And then, eventually when I kind of go on my exercise routine, and hindi ko na siya nararamdaman, parang hinahanap-hanap ko na siya. Parang feeling ko hindi maayos yung workout ko if I don't feel that pain. There we are. Hi, Doc Rai. Oh, gumanda yung
Okay, sorry. I changed my background. I had to move and connect to a different.
Nako, I think it's still a little choppy, Doc Rai. Oh no. Maybe we can maybe try like your phone. Yeah, it's kind of you've kind of frozen up on me. Yeah, so where were we sa kwento ko? While I wait for Doc Ryan, just kind of going back, like for me, I kind of equate pain, like the pain of working out, with um like my body is like, I know that the muscles are kind of tearing and healing back up again. And that's how you build muscle. So pag hindi ko na nararamdaman yung sakit galing sa workout, like feeling ko hindi siya ganun ka-effective. So I wonder, like, is that a good thing, or is that just a belief that I just seem to carry in my head? There we go. Hi, Doc.
Okay. Hopefully the
There we
internet doesn't fluctuate this time. Okay.
That
Where
looks
were we?
better. We were talking about acute pain versus chronic pain. So, like I said, my
Okay.
understanding was like acute pain is like I stubbed my toe and it was just really, really bad, and like
Yep.
namatay na ako ng kuko, whatever. But
Yeah.
I mean, it only lasts a couple of days, right? And then
Yeah.
chronic pain is something like that I would probably kind of need maintenance meds for in order to manage the pain.
Yes.
Um,
So
mhm.
yeah, but as I mentioned earlier, that we are just going to tackle maybe acute and chronic pain na lang, just to make it
Yeah,
simple. This is simple discussion.
got it.
So what you mentioned that you
So, sorry, you were saying what I mentioned earlier?
uh, Am I back?
Ye kind of. No pa rin. I think like you're still freezing. Oh no, this is such an interesting topic pa naman. Like I don't know if you guys know, but like like Doc Ryan is actually um been trained in acupuncture, etc. And he went all the way to Beijing, China just to study acupuncture in relation to pain. There we go. I think you're back. I can see you.
Okay.
There you go.
Okay.
Yeah.
Going back to the stub toe. Sorry. Yeah, so that stub toe pain can be first acute kasi it just happened, and then if it doesn't go away and
Mm.
the injury is really severe, it may last for
Mhm.
months, weeks, months to years. So it can transition.
Ah, got it. So
Yeah.
how do we stop that? Like how can I just make sure na this stub toe is going to fix itself eventually without me having to worry about, not being able to walk properly,
Mhm.
etc., and having to take medication for years because, I did something silly.
First and foremost, syempre we're really talking about their stub toe, but yeah, since you started it, let's just work from there, no?
Yeah.
First we have to rule out any fracture. Okay, did you break anything? Is there
Mm.
a tear in wherever part of your toe? Okay, kasi that's the most common cause of from an acute type of pain, converting into a chronic one. Bakit? Kasi it's supposed to be simple. If there's a fracture there, then you have to go to an orthopedic surgeon have it fixed, right?
Mm.
But if you're like, no, I'm okay, I'll just I'll pop in some pain meds, this will be fine. Meron palang fracture. What will happen? If there's a misaligned bone, and it heals like,
Mm.
kunwari the bone is like this, di ba?
Yeah.
Nagka-fracture, so it's kinda like this na. Okay?
Yeah.
And then you said, I'll be fine, I'll just take pain meds. And then it healed like this. So
Mm.
it will this protruding bone over here will keep on piercing the surrounding structures, the muscles, the skin, the nerves.
Yeah.
So that one can cause, can turn into a chronic type of pain. So
Yeah.
that's the first step to make sure that nothing's broken. All right.
Mm.
Number two, please do not self-medicate. Okay. Do not
I think
self-medicate.
I think
Maybe
that's the biggest, I know. That's the
yes,
biggest
yes.
thing that we kind of tend to do.
I know. I mean, yes, before when pre-pandemic, people will first pop in some pain meds and then go to the doctor, right? But because of the
Mhm.
pandemic, they don't want to go to the clinics. But the good thing about this, telemedicine is already ramped up. So there are a lot
Yeah.
of platforms, a lot of doctors, a lot of companies offering teleconsultations. You just Google it, telemedicine. You'll see it. There are a lot of companies already. So I'm just plugging my other business, Philippine Natural Telehealth. So pnth.net if you want to get the telemedicine covered for yourself and your family. 24/7
Mhm.
service.
And it's super
Thank you for the
affordable,
plug.
I checked.
Super, yeah, super affordable. Ah, you know about it.
Yeah, yeah, yeah.
Okay, yeah, super affordable, unlimited consult. So anyway, so if you injured yourself, no need to wait. Just call the service, talk to a
Mm.
doctor, and then the doctor can give you proper treatment, the correct type of medication if needed, the correct type of first aid treatment.
Mhm.
Yeah.
Yeah, I think that's really is like the biggest thing that we all like. Marami sa atin medyo takot sa doktor. Na baka
Yes,
mamaya pag nagpa-check up ako dahil dito kung ano-ano yung madi-discover, and then I don't
that's
want to
true.
know. I
Yeah,
would
yeah,
rather
that's
live
true.
in denial, 'di ba? Rather than find out. Or
Ignorance is bliss, yeah.
oo, either ganon or like lahat naman tayo may kamag-anak tayo in the medical field. So
Mm.
mapa-PT yan, mapa-nurse, parang dun tayo magpapa-consult para libre. And
Mm.
they don't necessarily, give you the right advice, well-meaning, but they don't necessarily have the tools to help you out with what's happening. So
Yeah.
Doc Rai, before when I kind of lost you, I was kind of going into my kind of idea of what pain is, and I usually relate pain to when I work out, right? So like when I'm going from couch potato to
Mm-hmm.
trying to move my body, parang for the
Mm-hmm.
next couple of days and weeks, parang
You'll be
I
in pain.
feel that oh, like I feel the pain in my body, and para sa akin, like that's a good thing because in my head, like okay, this is just my muscles tearing and repairing. So I kind of
Correct.
look
Correct. That's actually
for that pain.
that's quite accurate. Yeah. Yeah. That's a very accurate description of what's happening.
So, Doc, my question is like, is there like, can we overdo that, like the tear and repair process? Like, if I overdo my workouts for like I don't know the next week, because I really want to see results. What could possibly happen to me there?
Yes, you can overdo it in such a way that it can be life-threatening.
Hmm.
There's a condition called rhabdomyolysis. So it's a mouthful, but
Yeah.
it's a serious it's a serious condition because of acute muscle injury. So you can have acute muscle injury if you really overexert yourself. So the common cases in the ER for that one are those who attend spinning classes,
Hmm.
CrossFit, or those types of workout, the HIIT exercises, if they really overdo it. Kasi what happens is that you work out, diba? It's true that when you
Mhm.
work out, you tear some muscles. But if you overdo it, you're gonna tear a lot of more muscles, and then there's gonna be like broken cells in your bloodstream. These broken red blood cells, broken cells, it passes through the kidneys, and it's very stressful to the kidneys.
Hmm.
So if there's too much broken cells, I'm just oversimplifying it. If
Yeah.
there's so much broken cells due to workout that passes through the kidneys, it causes acute kidney injury. Sometimes the kidneys just shut down. It causes death. Okay, this is also the
Interesting.
common occurrence in death in those hazing for fraternities.
Yeah, yeah,
Ganun
yeah.
din yun
I
eh.
I
Yeah.
was going to say, but bakit nga liver parate yung ano,
Yeah.
yung tinatamaan when
Yeah.
like the pain is in other parts of the body?
Yeah. Actually, kidneys. Yeah, kidneys. That's why one of the signs is when you pee blood. You pee blood. Oh no, I
Got
have to
it.
go to the ER. I might
Uh-uh.
need the dialysis or something.
Interesting.
Yeah.
So like
So
like so in my head like there really is such a thing. Kasi 'di ba when we do CrossFit, when we
mm,
do spinning class, it's the mindset is you always want to push yourself. Like push
yes.
yourself, get to your next level. So
hmm
that's not always healthy.
I mean, in anything naman eh, 'di ba?
Yeah.
Anything, if you take anything in exaggeration or ano siya, it's also bad eh, 'di ba? So everything should be moderately taken in, especially with exercise. I'm not saying I'm anti CrossFit or anti. I
Spin.
did CrossFit before. I used to do spin classes. I love it, such a workout. But maybe
Really?
do it gradually. Kasi 'di ba, kunyari, yes, you said, couch potato eh. Di ba yung mga couch potato people parang say, oh, this is one morning, okay, I want to change my lifestyle. I'm gonna attend spin classes.
Yeah,
And then
that's how it
pushes
usually
himself.
happens.
Then you start gradually. For those who are not working out with zero exercise talaga, you start gradually. Start walking. As simple as
Mm,
that. From nothing to something is already a big step. You don't
yeah,
need to, from zero to step number 11 or 10. Hindi ganon. Don't skip
correct.
step one, step two.
Yeah, that and going from being super sedentary to something small actually helps you build a habit rather than
Yes.
going from 0 to 100 na hindi naman
100.
sustainable.
And then
Yeah.
zero again.
Yes, basically. Kasi give
Yeah,
up ka na after a week.
yeah. Buti kung zero lang, yung ibang tao goes to negative pa. So that
Mm.
means they're gonna stop working out, but their appetite has already increased. They start
Oo.
eating more. So pa-negative ka pa, di ba?
Correct.
Yeah. So start
Sige,
slow but sure. Yeah. Go ahead. Sorry.
we have a question from Tel here. She goes, okay, medyo random. How do we detox naturally from heavy metals?
Heavy metals. First siguro limit the exposure to that heavy metal. Kasi heavy metals you can get that from air, from water, from food.
Yeah.
So if you know the source of heavy metal that you're getting, cigarette, for example. If you're not smoking, people around you are smoking. So step out of that. Ano, don't expose yourself to that.
Mm,
So it's easier now than pre-pandemic because in the for the air ha. Kasi
mm-mm.
I mean I'm looking at the sky right now. It's clear. It's been clear, diba, since the
Yeah,
pandemic. So the pollution has significantly gone down now. But cigarette smoking, stay away from people who smoke.
yeah.
For water, just drink. No one drinks naman from the faucet here in Metro Manila, you know. But
You
so that's
cannot.
not our problem. Yes. From the food that we're eating, a good balanced meal that's only my good balanced meal. Why? Kasi most of the heavy metals we get it from from deep sea fishes eh.
Yeah, unfortunately.
Salmon and like that. And it's
Yeah.
hard. You can check naman. You're gonna buy salmon or any type of fish. There's no checking eh. I'm not telling you not to stop eating fish, diba? There's
Or maybe
limits.
like choose organic, choose,
Yes, organic. Best effort.
usually kasi pag farm tapos malakihan, that's where you get a lot of the
Correct.
mercury, etc. Yeah.
Correct. Correct.
Mhm.
So first is stay away from that. The next thing is that actually dun pa lang eh, no? Staying away from that. Your body will
Mm,
not kasi the question is naturally detoxify yourself eh.
yeah.
So dun pa lang ano na your body will get rid of it na eh. Next
Mm.
there are some supplements, charcoal. Charcoal kasi it's parang magnet yan eh. The charcoal. It
Ah.
sucks in
So the
I'm not
activated charcoal.
actually
Yeah.
activated charcoal. Hindi yung charcoal uling for barbecue. Not, baka I see you chewing on that charcoal. Don't do it ah. Not that one. That one the medical grade naman. Oo,
Mm-mm.
kasi it sucks in. It's like a magnet, sucks in heavy metals. And the principle also of reflexology, sa foot. Part
Mm.
nun is heavy metal detox, wherein you expose your feet to. Of course, this depends on if you believe on it or not. No? Pero there's a
Mhm.
principle to that, a natural healing type of principle that says if you expose your feet to a magnetic clay or to ions
Mm.
or to these stuff or to ano pa ba, maybe Epsom salts also.
Oo.
It can help you detox with that. Now, the other
Ah,
things that you can find from the market, I don't know eh. Yung iba yung dinidikit lang. I don't know
oo,
the
yung
science behind
tinatapal
it.
sa paa, oo.
Yes, yes. That one I'm not very sure. But
Oo,
I'm just sharing the things that I'm familiar with.
yeah. And I think like our body naman naturally detoxifies on its own. So maybe like if you just get rid of the
Correct.
cause, then the
Yeah.
body can just do its work,
Yeah.
normally.
Exactly. Yeah. I always tell my patients the body was created perfectly.
Yeah.
Perfectly. So you just remove the bad ones. It will heal itself. The
Mm.
things that I've said, it's only gonna help. Give you a nudge, kumbaga, no? But the body knows what to do.
Mm-hmm. She has a follow up question. Is chelation therapy safe for heavy metal detox?
Depends. So why do I say depend? Kasi there are several I'm not an expert. We don't do that in the clinic, but I have colleagues who does it, who do it. If I'm not mistaken, you should be clear of certain conditions before you'll be allowed to undergo chelation therapy. But yes,
Mm,
chelation is one of the therapies that can be done to get rid of heavy metals, among
got it.
other things.
Mm-mm.
Among
We
other
have our we
things.
have our own kind of heavy metal detox service at Centro, don't we?
Yes,
I've never done it.
that one naman is we have a magnetic clay. Um, uh, so it's a foot bath. So that's again it's based on the principle of reflexology.
So it's very traditional Chinese medicine.
It's part of the natural medicine.
Yeah, got it. There you go. Thanks, Tal. I hope that answered your question. Okay, sige. Back to pain and recovery.
Okay, okay.
So we've been talking about pain a lot, and I'm pretty sure like we get a lot of athletes in the clinic. We get a lot
Mm-hmm.
of people with chronic pain that come into to the clinic. What are our usual cases in relation to pain?
My favorite type of pain, my favorite talaga,
You
no,
have
is
a
low back pain
favorite?
and neck pain. Yes, it's really my favorite. Kasi it's so effective. You know,
Mm.
I still get surprised in the clinic. I know if I read it, we study it in Chinese medicine and the books in acupuncture. It says, okay, for these types of pain, use these points, and it will work. And if you see it work, you still get surprised. Parang, wow, it really does work. Alam mo yun? But from our experience, from doing this for several years, I think I've been doing acupuncture already for 8 years now. Um, the low back pain and neck pain, acupuncture is very good for that one. Of course, sorry, answering question, those are the two most common types of pain that we encounter in the clinic. And the source is usually the same, no? These are
Mm.
people who work in front of a computer for long periods of time.
Yeah.
Kasi like, di ba, like you for example, we're both sitting here. You don't notice
Yeah.
it, but sometimes you're just slouching. You know,
Yeah.
you're slouching. And imagine if you're working, typing or reading something, your neck it becomes stiff. You don't move it. Your eyes just moves it because you're
Uh-uh.
stressed. Okay.
Yeah.
So what happens there is that it's either the neck or the lower back starts to hurt, gets affected first. And then since
Mm-mm.
the spine is all connected, we call it ano cassette. Parang siyang cassette sa ano cassette organ, cassette sa in the X-rays. Patong-patong siya like this. Okay. So
Mm.
if one area, either the neck or the lower back gets affected first, the whole spine will sort of compensate, moves awkwardly to help
Mm.
to parang minimize the pain in that area. Now that awkward movement will move up or move down. It's gonna affect the whole
Mm-hmm.
spine eventually.
Yeah.
So
It might take
example,
weeks, months, or years, no? But it will.
yes, it will. So sabi ko nga, either the neck gets hurt first or the lower back gets hurt first, and it will go up or it will go down. So
Mm.
if you don't do anything about it, you just keep. Kaya sabi ko, I hate people. I tell people stop self-medicating. Eh. You ano,
Yeah.
if they do anything about it, the pain continues. It will creep up or creep down, and then before you know it, it's been years already. And it's already hard to treat.
Yeah.
Yeah.
So really like on the onset pa lang, go in and
Onset,
get checked
yes.
already. Yeah, what I've been seeing
Yeah.
a lot of Satin in social media is a lot of carpal tunnel. Like a lot of
Mm-hmm.
people come in with like carpal tunnel syndrome that, masakit na, like they
Mm-hmm.
can't, ano na, they're looking for other avenues to relieve the pain.
Yeah.
And that's what I see a lot of photos of people with their hand out and then all the needles, like
Carpal
all the
tunnel, yeah.
needles there. Yeah. So like what usually happens though with carpal tunnel? Because I think like that's one of the most common. Again, it's work related. It's related
Yeah,
to
yeah, it is, it
sitting in
is.
front of a keyboard or a laptop all the time.
In carpal tunnel, so I have a pen here just to show you how it works, no? The carpal tunnel and carpal tunnel syndrome. If this is your hand, no, the carpal tunnel is here. So there's a tunnel here where the
Mm-hmm.
median nerve passes through. Okay, like this. And
Mm-hmm.
then, hawakan ko lang like this, ha. And then, of course, this is the median nerve. There's a sheath covering it like this. So, ganyan yan.
Mm-mm.
So, the tunnel is where, the gap between the sheath and your wrist and here, no? That's a
Uh-uh.
tunnel. Because of trauma, texting, or let's say this is the table and then your wrist is like this and you type, okay? Parang it's called a trauma of overuse, no? Kasi it's not painful
Mm.
naman when you do this eh. But if you're like
Yeah.
this for hours and hours a day, week after week, it's causing continuous trauma. So the covering here, it gets thicker and thicker. Now it starts to press on the median nerve. The median nerve kasi as it goes through here, it supplies this one, this one, this one, and the middle side of this one. Sorry, lateral side of this one. So ito siya. Okay, that's why so people there, you're not sure, do I have carpal tunnel because my fingers hurt? If ito yung
Yeah.
sumasakit, yeah, maybe you do have carpal tunnel syndrome. But if your pinch
Mm-mm.
is the one hurting, that's not carpal tunnel. Because when you say carpal tunnel, it's the median nerve that's problematic.
Got it. So if you're watching this and it's your fingers, because for me, when you say carpal tunnel, feeling ko like ito yung sumasakit. So I'm
It
like,
can hurt,
like
yes, yan
that.
din.
That's what
But it's
I'm
really
probably
here.
going for. But it's
It's really here. It gets numb. There's a tingly
mm,
sensation, a numbness, tingling, electric-like shooting pain.
got it. Okay.
Yeah.
So yeah, if that's what you guys are kind of feeling, get
Mm-hmm.
checked.
Yes, get
Get
checked. Yeah.
checked. Get it checked. And I think for a lot of our athletes, naman, like the common ones that I kind of see is like a lot of knee pain. Like, why is it
Yes.
specific to the knee? Like, it's either
The knee
back
kasi is
pain or knee
yeah. For athletes, especially the ones that are jumping, running, or very agile. Agile kasi movement from one direction to another. Eh. The load bearing joints are the ones that suffer the most especially the knees. Isa yun sa pinakamalaking load bearing joints
pain.
natin eh. So ano ba yung mga jumping sports or movement from one direction to the other? Basketball, badminton, volleyball,
Yeah.
all
Jogging,
of these.
even like jogging,
Jogging not
running.
so much.
Oh, really?
Jogging not so much because yes, it's if you overdo it, maybe if your shoes are not great, yes, it can. But mas mataas lang yung the occurrence for those sports, yung movement from one direction to the other. I'm not saying that you won't get knee injury if you run. Pwede pa rin yan, no? But
Mm,
the most common cause lang talaga for knee pain, at least in the clinics, for those types of athletes, not for running. I
got it.
rarely see I rarely see knee injuries from runners. Yeah.
Interesting. Like
So what do you,
in my head, like that's would be a common one because they use their legs a lot. And then they talk about lactic acid buildup whenever
Mhm.
sumasakit yung mga that general area. And that's what they say is causing the pain. Is it true, or is that like an old wives' tale?
Lactic acid actually builds up in the muscles. Eh.
Hmm,
Correct me if I'm wrong, my ortho friends. Pero I don't think lactic acid builds up in the joints. I think
got it.
I know that it builds up in the muscles, and that's you know when you're cramping up, diba,
Yeah.
tigas the muscles like this. It's filled with lactic acid. It is not escaping. That's why when you stretch it out, it
Hmm,
spreads the lactic acid around. Pag nag-spread na si lactic acid, it's gonna feel better. It's the same.
got
That's what happens with acupuncture and the pain. Eh. Kasi pain usually we palpate your muscles. Okay, the areas in the back or the legs, and if
it.
it's
Mm-mm,
hard like this, it's filled with
mm-mm,
lactic acid. When you put needles in the muscles, it's gonna promote blood flow to that area.
mm-mm.
Pagpasok ng blood, mapa-flush out si lactic acid. That's how it
Got it.
works.
Okay,
Yeah.
so it's not the knee, it isn't the joint talaga. It's the sorry, I have a dog. It's
It's
the what do you call this? It's the
muscles
muscle
around it.
talaga. Okay.
Yeah, but well, yeah,
Um
for knee pain kasi sometimes there are a lot of structures there that can cause pain. Eh. The meniscus, the padding in the joints. It can be the ligament. So there are several things, not necessarily lactic acid.
got it. So, in terms of all this pain that we're talking about,
Mm.
let's talk about recovery naman. Because I'm pretty
Okay.
sure wait lang, my guys are going crazy. Help me, please.
I can't hear you. Sorry. Are you muted?
Yeah, give
There.
me one second. I have two dogs,
Okay.
and
Okay.
they're going
Okay.
a little too excited. Okay, in terms of pain treatment strategies, what do we have available in the clinic for somebody with pain?
Yeah. So the most common treatment that we have is acupuncture. That's our first line. Because it's the easiest thing to do and it's the cheapest also, very cost effective. The one that causes lasting effect also. Acupuncture can treat both acute and chronic type of pain. The only type of pain that the acupuncture cannot treat is the one that is caused by an anatomic problem. So why do I say anatomic problem? If
What does that
there has been a change in the anatomy, okay? Kunyari, bone spur. A bone spur kasi it's a degenerative bone issue. You get it when you get older. If this is the bone, before when you're still young, it's smooth.
mean?
Pero as you get older, there nagkakaspur siya, parang tusok-tusok na bones. Okay?
What causes
Now
that?
these, I don't know eh. Basta it's a thing that they see as you age. Eh.
Okay.
So if there are spikes na within the bone, these spikes natutusok yung surrounding structure. So we can't do
Mm,
anything about it. So those are the main limitations of acupuncture. So there's acupuncture. Um, uh, We have supplementation as well. The supplement, our main supplement, natural supplement for pain is turmeric. Turmeric is a very good anti-inflammatory.
Yeah.
But you have to see your doctor first. Don't just take turmeric kasi
Mm.
may mga people na hindi rin pwede sa turmeric. The ones with hyperacidity, the ones who are taking blood thinners, and other things. So talk to your doctor
Ah,
first. Yeah.
got it.
You
Kasi
know,
usually like
yeah,
you'll see turmeric in like in you know in the vitamin section, and we'd
I know.
assume that okay to take. Hindi pala.
Hindi rin. Especially for pain. Kasi for pain, you really need high doses. Turmeric kasi in different doses, different effects yan eh. For pain, it
Mm,
really needs to be like high, like 1,000 milligrams 3 times a day, something like that. So it can be that high.
wow.
And it should not be taken forever yung ganun kataas. So again, talk to your
Mm-mm.
doctor. So we
Got it.
have, again, acupuncture, the supplements. We have IV laser. So the IV laser naman, the IV laser, the red laser is very good for inflammation. Inflammation
Mm,
equals pain. Inflammation, that yun yung maga namamaga ka. So
mhm,
microscopically, there's inflammation that's happening. IV laser is good for that type of pain, whether it's acute or chronic, whether it's an autoimmune problem, fibromyalgia, stuff like this.
mm.
May mga autoimmune problems kasi that causes pain. Yan, very good si IV laser dyan.
Talaga. Like
Uh,
I see the IV laser every now and again at the clinic, and super manghang-mangha ako about like
yeah,
how it works. So you literally shoot a red laser
yes,
through the
through the
blood.
veins.
Kasi
Yeah.
IV pa rin siya eh. Oo. So that goes
Oo.
everywhere basically.
Yes. There are several benefits to having an IV laser. Eh. The red one, as I said, is a good anti-inflammatory, good for anti-inflammatory problem. Yeah, sorry, it is an anti-inflammatory treatment.
Mhm.
It can also help with with the blockage in the arteries. So seniors, I usually recommend it, especially for those who have coronary artery problems. Kasi coronary
Mm.
artery kasi nagkaka-blockage yung arteries eh. So with IV laser, it will help thin it out. It's good for people we call this mitochondrial fatigue.
Mhm.
Uh, extreme athletes experience this. When I say extreme sport athletes, sorry, for those ultra marathoners, they run 100 kilometers.
Yeah.
Um, triathletes, crossfitters. So I'm sure maraming ganun dito. If you find yourself, parang having a difficulty recovering. Para kasi, di
Mm.
ba,
Pagod
these
yung
people,
cells nila.
yes, you really work out so hard, and not just hard, but for long periods of time, di ba?
Mm-mm.
And then, before, kayang-kaya mo, pero tumatagal na, parang, I'm still tired, I'm fatigued. It's really hard
Mm.
for me to recover. You may have mitochondrial fatigue. Okay? So, the, ano, the IV laser can do something about that also.
Got it. Hindi lang siya, o kain ka na ng saging, kulang ka lang sa potassium. It's not
No, it's
that.
not that simple.
It's
Yes,
more than
yes.
that. Oo.
Mm.
What about ventosa? Does ventosa help at all?
Ventosa naman, it improves the flow of lymph and
Mm-hmm.
chi and everything and blood.
Got it.
Not for all types of pain. It will help
Oo.
for the types of in Chinese medicine kasi there are two types of pain. One that is caused by excess, the other one caused by deficiency or kulang.
Mm.
Okay. A more common type of pain is the one that's caused by excess. Pag sinabing excess, maraming blood nandun sa area na yun eh.
Oo.
So just like acupuncture, as I said earlier, the blood rushes in and it spreads it out. It's the same thing with ventosa. If the part of your back, like here, it's hurting, and then assess ni doctor namin na, oh, there's, a buildup of, there's too much chi there, too much blood. Ventosa is something
Ah,
that you can do because ventosa can move it.
got it. Like in my head,
Yeah.
kasi like ventosa is like that treatment
Massage
that my
lang.
titos like. Oh,
Massage lang. And then they use yung mga baso lang like this
yeah,
in the
exactly.
provinces.
Mm. Tapos makikita mo like for the next 2 weeks, like
Yeah, they
like
have,
sobrang
yeah.
dark ng likod nila, and
Yeah,
like
si Michael Phelps. Yeah, I remember in Olympics, pinasikat ng Ventosa because he was
yeah,
there
yeah, yeah.
without a shirt and a lot of Ventosa Cup,
You see the cups. Oh,
markings. Yeah, so that's what
and
it's
then
for.
so it's more to help balance out, not really for pain.
It can still help pain, but again, only for those types of pain that's caused by an excess. When I say excess, it's a Chinese
Yeah.
medicine term. So
Uh-uh. So this is like excess of one of the five elements, tama ba?
excess of
Or
chi, excess of blood, that one.
ah, just strictly just that. Interesting.
Yeah.
So Doc, like now that we're all kind of stuck at home,
Mhm.
do you have any I don't know, like suggestions for people who are dealing with some sort of pain, aside from seeing you, of course,
Mhm.
that can kind of help them get started in alleviating whatever, pain they might be having? Is pain and inflammation the same?
Inflammation causes pain.
Uh,
Yes. Now, what causes inflammation? Yan yung maraming reasons.
okay.
So inflammation causes pain.
Mm.
Um, uh, the best advice that I can give people experiencing pain from home is just to move. There's this
Talaga?
misconception, eh. Yes, there's this misconception. There's a movement, that promotes movement. Okay.
Mm.
One of the major misconceptions about pain is that, oh, I have pain, so I have to sit it out or rest it out, lie
Oo,
down,
like
rest.
elevate
No.
whatever it is. Oo.
Yes, yes. I mean, yes, you can do that, but iba talaga, they stay at home, eh. No, they don't
Mm.
walk, they just lie down. But, oh, I don't want to move, I'm in pain. The more
Mm.
that you don't move, the more they stop moving, the more that you're going to experience pain. Okay?
Got it.
Movement will really help with the pain. I'm not saying that you have to run around or something, just move.
Oo. Like
Walk,
walk around.
you do stretching, you do yoga. I love yoga. You
Mm.
can you don't need to go to class. I mean, yes, you have to attend one or two classes of yoga for you to learn the form, kasi you
Yeah.
might injure yourself. And
Yeah.
then go to YouTube na, no? There's a type of yoga that's very difficult, but there's a simple type. So you do that.
Yeah.
Promote
Like
promote
yin
blood
yoga.
flow.
Yeah.
Yes, the yin yoga. It makes me sleep lang doon, yin yoga.
Yeah.
It's very relaxing.
Ganun siya ka-relaxing.
Yeah. But movement, yes, definitely you should move. That's the thing that you can do from home.
That
Move.
is so interesting. But yeah,
Very
that makes
simple.
sense. Yeah, like
Yeah,
kasi
very
usually nga,
simple.
like if you get into a car crash or something, like the PT will force you to like relearn to walk or whatever, even if it's
Yes.
painful.
Yes.
So yeah, that I
And
think that concept travels. Yeah.
your body's gonna release a lot of endorphins. Endorphins are happy hormones.
Mm.
You know that when you work out and then you sit on the lie down, para I don't wanna move. It feels so good. That's endorphins.
Uh, the
Yeah. So
satisfaction.
very simple. No, move. If you have pain, move. Just move.
Yeah. Is there anything in terms of diet that they can do to help or hinder their recovery?
Um, if the type of pain that they're experiencing has something to do with gout,
Hmm.
so you have to limit the things that can cause gout or that can cause occurrence of gout, such as high protein diet, red meat, the beans, those stuff.
Mm.
Actually, people who have gout, they already know what causes their gout. Eh. And ito talaga, Katia, I don't understand. Alam mo na eh, that munggo causes your knee, your
Yeah.
big toe to hurt. And for some reason, you eat munggo.
Yeah.
Grabe talaga. Yung
Grabe yung nakasanayan ng katawan. Talagang
Yes.
mind
Pero
over matter na lang.
siguro naman, they develop gout because they just love that type of food, di ba? That's why naman. Kasi, kunyari, patients talaga, ay nako, you know who you are, my patient. They go to you, Doc, I'm having another gout attack. Ano na naman kinain mo? Pagkatapos, gagawin na, kumain na naman ako ng ganito. Ay, alam na nga nila eh, di
Yeah.
ba? So,
Yeah. That
yeah,
makes
again, so that one, if you're predisposed to having gout, stay away from those. Do you know what those are?
mm
Foods are high in purine. Marami, there's a list.
Beer. Yeah.
Yeah,
Yung mga tita ko sobrang
not
hilig dyan
lamang
eh.
loob, mga ganyan, sisig, boppies, all of
Yeah.
those stuff, and red meats,
Pulutan.
yeah, yeah. And then of course the food that causes inflammation in the body. Can you guess what's the most common source of inflammation in the body? Food source.
Oh, food source. I don't
Top of
know.
mind. Top of mind.
Sugar. Because
Sugar,
that's been my
exactly. Di ba? You've been talking to a lot of our doctors. Sugar talaga.
Sugar.
Sugar, not just
Grabe
kasi
the
people
effect.
say, sugar, o sige, they're talking about the sugar, the powder thing that they see. Ang daming sugar around, ah. I'm not talking
Yeah,
about the ones that are natural, like fructose in fruits, no, not that
yeah,
one. Sugar, cakes,
yeah.
biscuits, sugary food,
Breakfast
donuts.
food in general.
The
Yeah.
the American breakfast.
The
American
American
breakfast
breakfast.
kasi, yeah, you have sugary treats,
Even
no?
even like the Pinoy
Pancakes.
breakfast, like longanisa and tocino. I mean
Those stuff, the one that
isn't
they
that what
mix, eh.
we
Uh,
Oo.
ano rin siya, no? It causes inflammation also. Pero sugar kasi talaga. That's the number one
Grabe, no, but
inflammatory food
but
group.
we were addicted to sugar. Like that's
I
the I
know,
mean,
I know.
right? Like
Sugar and smoking, they're
we-
the same eh. Kaya sabi na, di ba, why are there a lot of movements trying to stop people from smoking? I'm not saying you should start smoking, huh? I'm just saying they're the same
mm,
eh.
yeah,
People should have ads also trying to limit people from eating sugar. It's the
for
same.
sure.
The same thing. Pareho din, ganyan din yung couch. The
Mm.
couch kills more people than cigarette smoking. Kasi the
Correct.
couch, di ba, they just sit down there, they're not
Not
doing
doing
anything.
anything. Yeah.
Yes.
Like your
Yung
muscles
ganun.
are atrophying na. Like tapos na tayo nasa
Yes.
pandemya pa. So we're all a little depressed. We're all going
Yes.
through some kind of trauma. We're
I
all
know.
going through PTSD together. Tapos di ka pa gagalaw. So,
So
yeah,
movement is key, not just for pain, but for everything. For a better mindset, kasi it makes you clear. It makes your thoughts
exactly.
clearer. No, those voices that you hear for people who are ito yung sinasabing voices that you hear. It's not because you have a psychiatric problem. Pero for those people experiencing depression, yun
Mm-mm.
yung term nila parang yan na may bumubulong na naman sa akin. Meaning they're having
Yeah,
those episodes na naman. You just have to
yeah.
move. Sabi ko happy hormones. You need happy
Get
hormones.
sun. Uh-uh.
Yes.
Get sun, sweat, definitely. Doc, I'm kind of curious, no. Since we're, like we're talking about, acupuncture, and there are a lot of acupuncturists, naman, in the country. But what
Mm.
makes our central doctors different in terms of mixing acupuncture and functional medicine and integrative medicine with regard to pain and recovery?
First and foremost, all of our doctors go through the same. I mean, we train our doctors also. Every time there's a new doctor, we show them like how we do it, and how we do, what points we use. We're not telling them to use those points, but at the very least, follow the same guiding principles.
Mm-mm.
So that's why there is a centro brand already, centro type of healing. Kasi
Yeah,
if you ask what is centro holistico, are we an acupuncture? Kasi acupuncture one of the most popular treatments that we have. Eh. Are we an
yeah,
acupuncture clinic? Are we an alternative medicine clinic? Are we an integrative medicine clinic? Are we a functional medicine type of clinic? We are
yeah.
all of those. So that's
Mm-hmm.
the brand of Centro Holistico. We mix everything.
Yeah.
So again, what makes us different? Because of the combination of all of these things, that's the one that makes us special.
Mm-hmm.
And we train our doctors the same way. So pretty
Mm-hmm.
much the quality of treatment from one doctor is similar to the other.
Yeah.
I say similar, not the same, because each of us we still have our own personalities, and sometimes we add a little more sugar. I mean, you add a little more of our touch in the treatment.
Yeah.
Okay, but still, the backbone is the same.
Yeah. And I think for me, at least, like with my experience at Centro, what's interesting for me is you guys, you don't really give a band-aid solution. So like in terms of pain, there isn't just, oh, take these pain meds and see me in 2 weeks. It really is, okay, this is how we're going to address it here, but you also need to do the work. And you
Correct.
also need, like you need to move, you need to fix your diet.
Mm-hmm.
It really is the doctor and the patient coming together to work on the wellness and the well-being, instead of just addressing whatever kind of like symptom is coming up, and then that's it. Parang I've realized that I have a
You have a
longer and
role.
yeah, and I have a better relationship with my doctor
Mm-hmm.
because of the treatment plan. It really is, you really need to do this, or versus I would suggest that you do this. If you don't want to, nasayo na yan. Pero
Mm-hmm.
this is what may happen to you. Like I was telling Doc Candy, it took me a year to agree to do an elimination diet. Patiently waited for me to go, sige na, I'm ready na, I'll do it na. And, I had so many realizations just getting rid of sugar. I never realized just how bad it was. And also like the different levels of pain that you get when you are taking sugar off of your diet. Like I had a migraine for like 2 days straight
You detox from sugar, huh?
because of the
Yeah.
withdrawal.
Yes, yes.
Hello. So
Wow, wow.
yeah. So yeah, and then acupuncture, colon cleanse, the IV drips, like they all help to they all help to combat like what's coming up.
Mhm.
But my big realization is like I really need to put in the work.
Yep.
Otherwise, sayang lang lahat to ng pinagdaanan ko.
Correct.
Um, and I think for
Patient,
me, like that's what makes Centro so special.
patients should understand that the healing is a journey. It's not
Mm,
if a doctor offers you band-aid treatment, take this and then everything will go away.
mhm,
Kulang siya because whatever you're feeling, it's a product of what you've been doing or what you have
mm,
exposed yourself to for weeks, years maybe. How do you expect it to go away in one snap of a finger? It cannot.
mm.
In 1 week, in two
Yeah.
weeks, that's not. Unless you just stubbed your toe, right? So you stubbed your toe, maybe madali lang yan. Yes, but pansin ko kasi, no, most of the patients that we get are not acute pain eh.
Mm,
Usually chronic yan. Bakit? Kasi they've gone to several doctors already, hindi nawawala. So they
mm,
go to us. So
mm,
yun na nga, it's correct that what you said, no, we really create a treatment plan. It's not just one treatment. There's also there's advice on the diet and the movement and exercise. Kunyari, let's go back to the most common type of pain in the clinic, low back pain. How can you treat the low back pain if you just give pain medications?
yeah.
That's it. Diba? Even
Mm,
acupuncture, if you just treat the patient with acupuncture with a low back pain, how can it go away if you don't advise the patient to sit up properly? Diba?
correct.
Change the work table. Change the posture.
Mm,
Advise, kunwari, talagang ganun yung work, 8 hours a day sitting down. Advise, 15, 20, 30 minutes, you stand up, you stretch, you walk around.
yeah.
You have parang the question earlier, how to naturally detoxify yourself from heavy metals. Ano yung sinabi ko first? Remove that thing in the equation first.
Mm,
Diba? How can you get better if you're doing the same things? Diba? How can you expect a different result if you're
correct.
doing, diba, the same thing all over again?
Which I'll be honest, I think that's what a lot of patients expect from doctors. Na parang, oh,
Yes,
we're going to
exactly.
you. Please be the miracle worker. And if it
Yes.
doesn't work, it's your fault. Kasi you aren't that good enough a doctor.
Yeah, exactly.
So I think like at least for me like that's my biggest kind of takeaway with regard to pain and recovery. It really is a process. Although we may want to have the band-aid solution to make the whatever the pain is to stop right away, there needs to be a change din talaga in our lifestyle,
Mm,
and what we're doing day to day that has been aggravating the pain or has been making it worse. And
mm,
yeah, a lot of the time we know naman what it is and denial lang talaga tayo. So I think that's where
mm,
the doctor comes in to like show that mirror to say that,
mm.
you know what you're doing. This is me repeating it na to you. So we have people like that, diba, na parang alam naman natin, pero kailangan natin marinig sa professional to go, oo
Mm.
nga, tama, alam ko yan eh. So yeah, so Doc, last question for you.
Yeah.
I told our viewers earlier that the interesting with you is you went all the way to Beijing, China, just to
Mm,
study about acupuncture for pain.
mm.
Um, what was your biggest learning, like going all the way over there to learn that?
My biggest learning is that, or realization is that we as Filipinos, the Filipino acupuncturists, we have actually developed our own way of acupuncture.
Mm,
Meaning, kasi there's everything came from China. The acupuncture at least.
mm-hmm,
So if you go train in Japan or Taiwan or Hong Kong or wherever, it all came from China. But
mm-hmm.
Japan has already developed their own. Taiwan has already developed their own. Filipinos also have already developed our own acupuncture. Kasi doon I realized that if I follow everything to the T, what I learned in China, I'm gonna lose my patience because it's so painful what they do. Really painful the way they manipulate. So I just learned key
Uh-oh.
techniques and I just and then I try to apply it in the Filipino setting. It can't be
Got
the
it.
same. Can't be the
Mm-mm.
same. We can't say naman din na ours is better. Iba lang talaga yung culture nila. Like in the Chinese patients daw kasi if they don't feel pain, you're not a good a doctor.
Seryoso?
Yes, ganon. And then funny sila every time they go back you see the previous marks, the previous points where the doctors is kasi nakita mo lahat may pasa malalaki.
Uh-oh. Oh my gosh. And for them, that's a
That's
good
my
thing.
greatest takeaway. Yes, for them that's a good thing. Um, uh, what else did I learn? It's very it's very. I think that's the main. That's the deeper insight that I got. But
Mm.
technique wise, one of the things that I learned there that here it's not done here. Oh, I haven't seen it done here. I have a patient that who's had it's a colleague also. He's also a doctor who had a thigh fracture, the femur, the biggest bone in the body. He fractured his leg in I forgot where in South America ba or ganyan. I don't know. But they botched the surgery there. Okay, they botched it. No, it's a very bad type of fracture. They did another surgery here, twice pa nga. Here also, nakatatlong surgery na siya. So after the
Yeesh.
third surgery, 4 weeks after, did an X-ray, wala pa rin nakikitang healing. That's why he went to us.
Mm-hmm.
So good thing I saw that. No, I learned that in China. So I did the treatment. The type of treatment is that we use the longest types of needles. We really put it in there, close to the bone, close to where it can't be done by anyone. Kasi
Yeah.
if you overdo it, you might injure the patient. Anyway, that's why I think that's good that I learned it there. You know what? Lo and behold, 2 weeks, 3 weeks after, it started healing.
Oh, wow.
So I'm not taking the whole credit for it, but 4 weeks after surgery without signs of bone healing, maybe I did something. I
Mm.
would like to believe that it helped the patient. So those are the types of treatments, that types of skills that you would expect in Centro Holistico. If you don't do specialized training, you won't be able to expose yourself to those types of cases. You won't be able to apply it to your practice here.
Mm-hmm. For sure. And,
Yeah.
and 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 what I appreciate also is that everybody at Centro is just so excited to learn. So you guys are always going next level in terms of education and application.
Yeah.
Yeah. So, Doc, where can patients find you if they want to set up an appointment with you? Of course, we're going to be closed all week next week, but
Yeah. Yeah.
hopefully after Easter. Yeah. Which clinics you go to and what days?
Actually, I've limited my clinic hours in days because I'm handling several businesses now.
Hmm.
You can set an appointment at Centro Holistico Alabang every Tuesday, 2 p.m. onwards.
There you go.
That's it.
So,
So it's limited. So you try to catch
yeah.
the times that I'm there. Usually it's
So
full. Yeah, joke
specialized.
lang. But yeah, yeah.
So yeah, very, very specialized. If you really have some sort of pain that maybe the other central doctors can't address, then Doc Ryan is probably your guy. Um, so yeah, that's it for this episode of Wellness Weekends. Thank you everybody who's joined us. Thank you so much, Doc Rai.
Thank you so
It's
much, Kat.
it's lovely to see you again. I rarely not see you at Centro anymore. You're usually at Binondo or somewhere and buying needles or whatever. Um, so yeah, it's really great to get to talk to you and get to pick your brain about pain and recovery. If you guys have any other questions for Doc Ryan, just leave them in the comment section, and we will have him get back to you.
Thank you so much,
So
everyone. Thank you, Kathy.
Yeah. Thank you guys. That's it for this weekend. See you next Sunday. So yeah. Bye
Okay.
guys.
Bye bye.